Hello, I'm Mridula Rai. I'm a cardiologist and I am the director of cardiology clinic at Women's Hospital. A heart attack, let me first try to explain you what a heart is. Heart is a pump for the body. It's made of muscle which pumps blood, and that's how blood is supplied to the entire body. The heart muscle itself needs oxygen, which is supplied to it by blood vessels. There are usually three heart arteries that supply blood to the heart. Now, heart attack happens when that blood supply is either severely narrowed or it is completely cut off. So there is no oxygen for the heart muscle. And the heart muscle is starved of oxygen and is at risk for dying, and that is what is a heart attack. Symptoms of heart attack for men and women, mostly the most common symptom in both is chest pain or chest discomfort, usually center or left-sided, can go up to your neck or jaw, can go down your left arm, can be associated with shortness of breath. You can have nausea, you can see lightheadedness, cold sweats. It can be something different as well, and that's why we need to be more cautious. Well, it can be right-sided chest pain. It can just be pain in the arms or any area of the upper body. It can be pain in the upper part of the abdomen. Women have more symptoms that are not classic than men. Even then, chest pain that I described initially is the most common symptom in women too. It is common for women to have just shortness of breath or fatigue or pain in the upper part of the body in general. Prevention of heart attack starts with awareness. There are risk factors that we all need to be aware about, and that's how we can prevent heart attack. When we talk about that, we talk about things that we can modify and things that we cannot modify. So then we come to the things that we can actually change. Well, number one, high blood pressure, diabetes, high cholesterol, smoking, your own weight, how much stress you have in your life. Those are things that we can change. So let's talk about it one by one. High blood pressure. We won't know about high blood pressure unless we go and check it. So we check the blood pressure, well, it's high. Things that we can do is just lifestyle changes in weight loss, eating less salt, eating healthier food in general will help with prevention of high blood pressure or even treatment. But if you do have high blood pressure, then you need to see a doctor and they can prescribe medications that will control it and subsequently reduce your risk of having future heart disease. Next is diabetes. Exact same thing. People do not have symptoms for a long time unless you actually go and check your blood sugar. So that's why blood checks annually are important, and visit to your primary care doctor is important. So, same exact thing, diabetes and high blood pressure a lot of times run hand in hand, meaning people who are at high risk for high blood pressure will have diabetes because there are similar things that can predispose you to both. Lifestyle changes again, eating less carbohydrates, weight loss. And if you do have diabetes, then you need medications. Similarly, high cholesterol, need a blood work and then either lifestyle changes or treatment of the problem. Smoking, well, no one should smoke. So if you smoke, you have to think about quitting. It's not easy, it's an addiction, and it's a difficult problem to quit smoking. It's hard. Many people wait for the day they have a diagnosis of a heart attack, stroke, or lung cancer when they quit. Well, we shouldn't wait that long. No one should smoke. I always tell my patients, it's like committing slow suicide. It's bad for you. You can't do it. You shouldn't do it. Good news is there are a lot of things that we can help because it's a difficult thing to do. There are medications, there are clinics that are devoted just for this. So seek help. Being overweight, it is extremely important. It's an epidemic in this country and worldwide. Obesity, which predisposes you to having high blood pressure, diabetes, heart disease, and a lot more problems. And it's again a difficult problem, but there are solutions. Lifestyle changes work for sure. So counting calories, eating healthier, reducing portions. Nothing drastic needs to be done, but we need to try those. Regular exercise is extremely important, and when I talk to my patients, I recommend moderate exercise for 30 minutes 5 times a week. If you can do that, everyone is busy, but our health is priority. So if you can do that, it's going to be helpful in the long run. Stress, well, with the pandemic, we saw how stress and things like that can worsen, health, physical health, mental illness. So it's bad. We all know it is extremely hard to take care of or treat, but there are things we can do. Exercise is one of them. If you exercise 5 times a week, you will see a difference. There are other forms of exercise like yoga, which is helpful in stress reduction, meditation. These are things that have been proven to help with stress reduction and should be tried. We discussed the symptoms of heart disease. So if you are heart attack, so if you are having those symptoms, you should call 911. Or if you see someone having those symptoms, you should call 911. Just to repeat, chest tightness, chest pain, chest discomfort. A lot of people describe it as elephant sitting on their chest or some restriction. Going down your left arm, going up the neck to the jaw, associated with sweating, shortness of breath, nausea, lightheadedness. Those are symptoms that need attention immediately. It can be more serious than that. Someone clutches the chest, faints, or they have a full-blown cardiac arrest. Well, obviously that needs attention, and you should call 911 immediately. No one should die of doubt. So if you are in doubt or you don't know, it's still better to call 911 and get it checked out than not to do it. And time is essence in heart attacks.